Hi, my name is Juliana Charak, and today I will be talking about childhood obesity in the United States, specifically focusing on the states with the highest rates of obesity. So the topics we'll cover today are what exactly is childhood obesity and why it is such a prevalent problem. We'll look at the National Survey of Children's Health and how obesity rates vary by state, and then the factors that contribute to childhood obesity, and why it is so much higher in southern states, in particular Mississippi, and then what exactly Mississippi has been doing to address this problem. So let's first start by talking about what exactly childhood obesity is. Childhood obesity is a health issue and considered to be a growing epidemic in the United States. This can be seen in the way that the prevalence of childhood obesity in the United States has more than tripled in the past few decades, so since the 1970s, as well as is evident in the image on the right. From 1980 to 2012, the percentage of obese children in the United States ages 6 to 11 has gone from 7 to 18%, meaning that as of 2012, more than one-third of children were seen to be overweight or obese. This is seen as a major issue because of the many risks and effects that come with obesity. Obesity threatens to shorten the lifespan of the United States if it continues and puts children at risk for serious medical issues such as heart disease, high cholesterol, high blood pressure, diabetes, sleep apnea, and cancer. As well, it oftentimes comes with issues of low self-esteem and depression. Obesity in children is measured based on weight for age percentile. Children that are obese are at a 95 percentile or above, meaning that they weigh more than 95% of children their age, and those who are overweight have a weight for age percentile between 85 and 95%. Obesity in children also threatens to affect these children as adults, since they are 70% more likely to be affected by obesity when going into adulthood. The National Survey of Children's Health published the map demonstrated to show state-by-state childhood obesity rates for children ages 10 to 17. The information was taken by surveying parents of these children about all aspects of their children's health, including height and weight. As you can see on this map, most states are fairly within the same range. Mississippi stands out as being the highest obesity rate with 26.1%. This is almost 10% higher than most other states. So the main factors that contribute to this obesity epidemic in children are what children eat, which over the past few decades dietary patterns have changed and the amount of average calories consumed per day has dramatically increased. As well, food portions have tended to increase. Socioeconomic factors. So lower income homes are at greater risk of being affected by obesity, and they cannot always afford extracurricular activities, and cheaper foods are those that tend to be higher in calories, fat, and sugar. As well, parents may not have the education to educate their children on proper food choices, making it difficult to instill these values on their children. Wealthy communities tend to have 3 times as many supermarkets as poor areas, which gives them increased access to fruits, vegetables, and wider selection of healthy foods. Another factor is the lack of exercise, which is due to the growing use of technology, such as computers, increased time watching TV, and a decrease in physical education in schools. This has led to an increased sedentary lifestyle, where 30% of U.S. children do not exercise 3 or more times a week. Genetics also play a role in obesity, which is family history, contributing to between 5 to 25% of the risk of obesity. Therefore, children with parents affected by obesity are more likely to be affected. As is seen in this image, psychological factors are also factors that play a role and contribute to childhood obesity. So, as you can see in this chart of childhood obesity rates in the United States, 9 out of 10 of the states with the highest obesity rates are in the South. So, according to Dr. Gopal K. Singh of the Maternal and Child Health Bureau, children in several states in the South are at twice the risk for becoming obese than children in Oregon, which has the lowest prevalence rate. So there are many factors that contribute to why the South has the highest rates of childhood obesity, and many of those are environmental factors, such as neighborhood crime, access to recreation facilities, outdoor parks and playgrounds, vehicular traffic congestion, fast food restaurants, and media promoting unhealthy food choices. As well, the South is the most impoverished region of the United States, So as we saw in the last slide, socioeconomic status is one of the factors that contributes to obesity. In addition, the weather in the South tends to be hot and humid, meaning less people will go outdoors for exercise, and lack in exercise is also a factor. The southern region of the United States is known as a stroke belt, which this map shows. This is because the South has the most amount of people who suffer from stroke, and the South has the highest rates of type 2 diabetes and hypertension, which are both factors that contribute to having a stroke, and obesity tends to cause both type 2 diabetes and hypertension often. So now we're going to look at Mississippi and why they have such a high childhood obesity rate. So in a survey of Mississippi high school students, 10% said they went a week without vegetables, 80% were not physically active for an hour a day, and 33% watched TV for 3 or more hours a day on school days. So children as young as 8 are being treated for type 2 diabetes in Mississippi, and as well, adults tend to set a poor example when it comes to eating habits. A major problem is when it comes to parents and them not teaching the kids the right way to eat. So Mississippi is the poorest state in the nation, where 21% are living below the poverty line. Because of this, it doesn't come as a surprise that eating habits in Mississippi are worse because of less access to healthy food, as well as both parents working. So they're more likely to go to fast food drive-thrus, and parents don't have the time to cook and have a proper, healthy, well-balanced meal. As well, household financial constraints prevent the purchase of fresh fruits and vegetables. So in order to try to combat this, Mississippi has started various policies to prevent obesity, especially coming to early childhood education. So these include regulations requiring licensed childhood education programs to allow or encourage breastfeeding and have a private space for mothers to do so, making drinking water available to children, having healthy eating policies and providing meals and snacks to meet the dietary guidelines, and requiring early childhood education programs to have time for daily physical activity and limiting screen time in early childhood education centers. As well, at a school level, these policies include elementary, middle, and high school physical education, and a time requirement for elementary and middle schools, encouraging safe routes to school so that children are able to walk to and from, healthy food financing initiatives, and a shared use of facilities so communities are able to use the school recreational facilities outside of school hours. As well, there's a Mississippi Obesity Action Plan, which is trying to strengthen awareness of obesity in Mississippi and changing the approach to nutrition and exercise within schools, as well as encouraging parents to be educated about healthy living for their children and themselves. Happy Healthy is a campaign focused on food in making Mississippi a healthier state, which is done by the Mississippi State University Extension Service. And so they have a food education campaign, which is trying to give parents healthier ways to choose and prepare foods and teach their kids how to eat healthy. So one of the major ones is preventing obesity with every resource, known as POWER. So they have each school to adopt a local wellness policy, leading to the adoption of stricter guidelines of what can be sold in vending machines and requirements when it comes to physical education. Schools were given the 5-star food grants to increase consumption of fruits and vegetables. This was given to 80 schools from 25 school districts. As well, fryers were removed from school kitchens and replaced with steamers. So 104 steamers were given to 41 school districts. There was a Committee to Move grant, which provided 25 grants of a total of $9,400 to 21 schools to purchase physical education equipment and resources. Team Mississippi had 450 kids from 1st to 4th grade spend a year being educated on healthy eating habits, which improved their nutrition and weight. And the Mississippi Healthy Student Act of 2007 required schools to serve better and healthier meals. So overall, we can see that childhood obesity is a major problem within the United States that needs to be addressed. In this presentation, I specifically looked at Mississippi and the southern region of the United States, which seems to suffer the most. Although many efforts are being done and programs have been started to address the problem specifically in Mississippi, it still is a major issue that we need to look deeper into the socioeconomic factors and access to healthy food for a healthy childhood. Thank you so much for listening to my FED Talk. Hopefully we can all continue to address this pressing issue of childhood obesity in the United States.